Welcome to Real Girl Talk. I am your host, Sherry Ricard. I empower women to stand in their purpose, to succeed despite the odds stacked against them, and to live their life knowing they're enough and worthy. Join me each week for powerful messages and interviews that will inspire you to create the life that you want. Now let's go. Hello there, my friends. It's Sherry Ricard, and I'm so glad that you came back to listen to the podcast. Thank you for being here. If you're new to the show, welcome to Real Girl Talk. And if you're a return listener, thank you for your loyalty in Real Girl Talk. I appreciate it. And I have a special guest for you guys today, and she's pretty impressive because I've been stalking her Instagram, and you may start stalking her Instagram, especially her Instagram stories when I tell you a little bit about her. Her name is Sivan Parienta. Did I say that right?
Yes.
Yes.
Did.
She's a registered nurse. And did you know I was a registered nurse too, Sivan?
No, I didn't.
Okay.
That's
well,
awesome.
You specialize in injectables. So she basically began this career with a plastic surgeon back in 2017. Is that right? And so
I think it was a little earlier than that.
It was a little earlier than that. And so you guys, she's going to tell you how to find her at the end of the show. But basically, she can make you look like you have had plastic surgery with injectables. So I'm calling her the queen of injectables. Thank you for Sivan. I appreciate you being here. So I'm going to start off with a couple of questions here because there are probably more questions that are popping into my head when I watch what you're doing. And I noticed that, you have beautiful lips. So if I could take your lips
Thank you.
and just pop them onto my face without any of the pain of injectables, that would be awesome. But I know that's not possible.
No pain, no gain.
No pain, no gain. I knew you were going to say that. So some of the listeners might be interested in knowing when you go to get your lips injected, talk to us about the process, the downtime, what is it exactly you're putting into our lips?
The products that I use are hyaluronic acid base, what is hyaluronic acid? Hyaluronic acid is a beautiful, natural occurring molecule you already have in your body. Unfortunately, when we get older, we just don't produce as much of it because your body basically is like, okay, that's not the priority anymore. The priority is like your vital organs. It's not that beautiful molecule that holds your skin up nice and taut. It's basically the foundation under your skin. When you start losing that, you lose volume in your face, which in turn creates wrinkles because your skin starts to sag. So the products that I use are all hyaluronic based because it's natural and we already have it in our body. So anything in the Allergan company like Juvederm, or even in the Galderma company, which is Restylane.
So when you inject that into your lips, how many times are you actually injecting, or how many times are you being poked in the lip, I guess I should say, with that needle?
So I always get asked this question, and the thing is, I don't have like a cookie cutter version of injecting. Like, I don't inject every single person the same, and I think that's what sets me apart from a lot of people. Like, your injection versus person A or person B is going to be completely different because your face and your lips are completely different than person A and person B. I don't really believe in like one size fits all or one injection fits all. So I don't really have an answer to that. It really just depends on the person's lips. And some people's lips are like super easy because they come in and they already have that really pretty shape. And then some people I really have to sit there and manipulate to create a prettier shape. Like, not everyone is born with naturally pretty shaped lips. So I definitely try to create that for everyone.
How long does the swelling usually last when you're doing your lips?
So that's a good question. So this is how I explain it to clients. The first week is probably the worst week, especially the first day after you get injections. Like, you're pretty swollen, and that's just part of the deal with injections. Like, it's not, I told my girlfriend this the other night, it's not a magic wand. I can't hit them with a magic wand and then their lips are perfect. Like, you're going to go through a little bit of bruising, you're going to go through a little bit of swelling, but it's fine. It's just, that's not going to last forever. So what I tell clients is, the first week you lose 10% of the swelling. Second week, another 10%, third week, another, and then the fourth week. So after 4 weeks, when your lips are finally healed, they're going to be 50% smaller. So what you see on my stories and a lot of people look at them and they're like, oh my God, she looks swollen, or that's too big. Well, that's why I post my clients' selfies, because you can see once it's healed, it looks completely natural and beautiful and just hydrated.
Right. I love to look at your Instagram stories because it does give you a good visual of the before and after. And I love it when some of them come back, and not just the selfies, but then maybe they have to come back for a second procedure,
Yeah,
and you can
that's
see
awesome.
what they did.
So you recognize those people, or you're like, oh, I remember
Yes.
her from.
Yeah, I can recognize them. And some of them, I mean, I know what you're saying, because it really doesn't make a difference if your lips already have a really good shape to them. Now, once you do your lip injectables, how long does it typically last before it starts to wear off?
And it does take a couple of treatments to really get the lip that you want. A lot of people are like, oh, well, I want it to look like how I did in the first month. Well, the first month you're really swollen. So if you want that size, you need to come back and layer on top of that. So normally, if you have virgin lips and you've never had it done, it's going to last 6 to 8 months. If you come back and layer another syringe on top of that, then at that point it's going to last up to 12 months because you're layering the product.
Okay, well, that makes sense. Now, with the jaw contouring that you do, that and also I noticed some of the cheeks when you do the injectables, and it kind of gives you a cheek lift basically, and then
Correct.
you do the jawline as well, and that is for slimming the jaw, because as we get older, we get the
jowls and the sagginess. I mean, it's for a lot of different things. Like, there's a lot of different approaches for the jawline. Like, there's some people that have a really big masseter muscle, that's your chewing muscle, and it just makes them look very square and very masculine. And typically those people are the ones that grind their teeth, have TMJ. So it's, I go in there and I use some Botox to like reduce that function of that muscle, which in turn makes the person's face look more V-shaped and slimmer. And it's not only for that, like some people just have really bad TMJ. I mean, I do it for myself because my whole life I've been grinding my teeth, and growing up I never understood why I had such crappy teeth and why I need to go to the dentist all the time. Well, it's because when I was sleeping at night, I was like grinding my teeth away, basically. That's one approach to slimming the jaw. So it's not for everyone. Again, this goes back to like not one injection fits all. I really have to see the person and be like, okay, do they need jawline slimming with Botox, or have they lost a lot of volume in their chin and jowl area where they need a little bit of contouring with filler? Do they have some submental fat, which is the fat underneath your chin? Do they need that kybellid off? Like, so everyone's different, and some people might need the trifecta approach. I had a girlfriend that I had, she had the TMJ and I had to reduce the muscle. She also had a little bit of fat underneath her chin, and she had a very weak chin to begin with. So I had to do a chin augmentation, and those 3 treatments together definitely gave her a very nice, contoured, and slim V-shaped face.
Something like that last. You said it was called the trifecta.
Well, I haven't named it yet, but it's just, those are the 3 different treatments that you can do together.
There's a good name for you. I like that name.
Yeah, the trifecta, yes. Once I get people to their desired look, and for instance, that treatment, it took me about 6 to 7 months to get Morgan, which is one of my friends that I did that for. And it took like maybe less, maybe like 5 months. So now she's where she needs to be. Now she's at the touch-up phase. So she comes in every 6 months. We make sure that like we Botox those masseter muscles and maybe do a chin augmentation every 8 months. It really depends on the person. Some people it lasts longer than others, and then some people it doesn't. It lasts like every 6 months, and it just depends on their lifestyle. Typically, the people that burn quickly through products are my crazy like gym workout clients that are like in the gym 2 hours a day, 6 days a week. Like obviously their metabolism is going to burn through the products.
Oh, okay. I didn't know that actually occurred.
Yeah,
so they do.
It's definitely a factor for sure.
So it does make a difference as far as your activity level then on how quickly you may have to come back. That's interesting to know. What other injectables do you normally see other than the jawline and the lips and the cheek? I know you do the Botox as well.
If it's a face and it needs an area to be corrected, I do it. I don't really have anything that I specifically only do. I actually just I look at people's faces like it's a painting,
Yeah.
and I just see the areas that need to be fine tuned to make them look their best. A lot of people don't know this about me, but I actually grew up as an artist. I did paintings of people's faces all the time. I did sculptures, and like the one thing that I always liked to paint and draw was faces. Actually, I was a makeup artist when I was 19 years old, so I have a very extensive artistic history, and so maybe that's what helps me see people's faces differently.
Right. Well, you do a really good job, and I don't care where you live. I know you're based right there in Dallas, but no matter where you live, I think it's really important that you find somebody that's as good as you and does as well as you do. They should fly. They should literally fly in or drive in, because I mean, when you're talking about the face, I know that you would agree, you can really get someone that is not as experienced as you are in injectables and really cause an issue, I would think. Correct me if I'm wrong.
I have a lot of corrections, so I definitely see that. I don't really post my corrections, and the reason I don't post them is because what happened to their face. And so then that's a whole other process. I have to do a lot of dissolver and dissolve all the filler, and then like slowly fix the person's face to back to what looks more natural.
Right. I understand that. Well, you do beautiful work. And I know that you're actually going to be on a show. Tell us a little bit about the show that you're involved in right now.
So I'm doing a show with Liz Kennedy, who specializes in basically beauty, anything beauty. She educates people on beauty products, beauty regimens, beauty treatments. And the show is focused on non-invasive treatments to make them feel better. You don't necessarily have to go under the knife and go under anesthesia to get the desired look that you're wanting. And also just kind of educating women that preventative measures along the way of aging is the best approach. So maybe not wait forever until you get Botox. I like to explain it to my 20 and 30-year-olds is I'm like, right now, you guys are a piece of paper folded into 2 or 3. So if you give me that piece of paper and you ask me to smooth it out, I'll be able to smooth it out very nicely. Versus the woman that waits forever and brings me a piece of paper that's crumbled into the tiniest piece and is like, can you smooth this out for me? And that's the way I kind of explain the wrinkles per se. So if you're going to get Botox done between the ages of 25 to 35, just kind of like I started getting Botox done when I was 20. As soon as I started seeing some stagnant lines and some of my lines going into my makeup, that's when I started getting Botox.
Yeah.
And now people don't believe that I'm 33 years old because they think I look like I'm still 25. I just take really good care of myself. And going back to the show, we're kind of explaining that it's really important to take care of yourself. When you look better, you feel better, and you don't necessarily have to wait until you're at that point where you have to get complete plastic surgery and get a facelift and all that.
What would you recommend? So what would you recommend to a woman that is, I know a lot of my listeners are between the ages of 35 and 60. And so we have a really a broad audience here, but say in the middle of that, once you start reaching.
Yeah, it's never, and going back to what I said before, it's never too late. It really isn't. I would definitely recommend Botox. Like, get Botox done every 3 to 4 months. I have a lot of women in that age group for me, as far as my clients. I don't know why, but they will like get Botox once every 2 years. And I'm like, you're not necessarily helping yourself. Like, you need to keep up with it if you want to really soften those lines. So Botox is a huge one. Like, get the Botox done. That will literally take years. Yeah, it takes years off of someone's appearance. And then, cheek volume, that goes away. I mean, volume in general in your face goes away. And that's when you start seeing the sagging, the jowls, or the eyes looking a little bagged or tired. So I recommend getting a cheek augmentation. It gives like a nice little lift, maybe even a chin and jawline contouring. It just depends on the person's face. Everyone ages in a different area, better or worse than others.
Right. I appreciate you so much being on. And I know you have to jump back to work, but before you go, tell everyone where we can find you. Tell us about your Instagram, because your Instagram stories tell basically the story of all of your clients and everything that you do. So tell us how to find you on Instagram, and tell us where to find you in Dallas.
Okay, so find me on Instagram at lips, Lips, by BYSIVAN. In Dallas at the moment, I'm at Renew Beauty. But the best way to really know where I'm at is just being on my Instagram. I tell everyone all the time. I update my clients all the time where I'm at. I travel a lot to California, again, to do the show. And I also work with Dr. Jonathan Sykes in Beverly Hills. So the best way really is through Instagram at Lips by Sivan.
That sounds good, Sivan. Thank you for being here. I appreciate it. And guys, before we go off, I just want to remind you about the workshop, the Create Your Life Vision Board Workshop in Baton Rouge on January 19th. Space is limited. So you can go to my Instagram, Empowerment is Beauty, and click over to the link. It will take you right to your tickets on Eventbrite. Please join us. It's going to be very inspiring and lots of fun. If you've never done a vision board before, you are going to be really surprised and really excited, because I have a great event that's planned for you. Thank you, Sivan. I appreciate it so much, and we will talk soon.
Okay, thank you so much for having me.